So I've been in the nursing field for many years. Most recently, I've been in OB-GYN for the past 20 years, and so I just have a passion for working with women and pregnant women and seeing them through their pregnancy journey. My daughter is a doula as well with this agency, and I have one granddaughter, but after the birth of my granddaughter, Lily was a surrogate. And for the surrogacy, she had a doula. There was a vast difference in her two deliveries. The support that she received from the doula just allowed her to be much more relaxed. It was a much more natural experience. It was seamless. And with her first baby, the first pregnancy, it was just much more tense. I don't feel like she understood what her options were about a lot of things. Like I said, it was more just presented to her and not asked of her. So they were just two vastly different experiences, and that had a lot to do with just my desire to help facilitate that for women in their births. Very often, nurses they're pulled between several rooms, several patients, so they're in and out. Your doctor most often will pop in when it's time for you to push. And so just think it makes a lot of difference to have that one-on-one support, to have somebody who's there, who's hands-on, who's encouraging you, helping you with positions, helping you with breathing, and just is a kind of a constant. It gives your partner a chance to take a break, to rest, and so that they don't burn out. But it just, I feel is very, very beneficial to have somebody that's there for you. A lot of times, just in the moment, patients are just given not so much options, but we're going to do this next. And they don't always understand exactly what's being done or what their options are. There's no real discussion that takes place. So I just like to make sure that patients understand, or my clients understand, that they need to actually be informed about what's going on and then consent to it. They need to actually say, yes, I understand, and yes, I'm okay with that next step. And if that means they need to take some time to talk to their spouse or their support people, think about it, have you come back in a few minutes and ask what their other options are, things like that. It's, I think, very important that people are aware, informed, and then actually give their consent to what's going to happen next. I never want to cause any sort of tension or anything between you and your provider. I'm just basically, like I said, there to support you and to make sure that you understand what's being told, that you understand what your options are. So I always just try to obviously get along well with everybody that's involved in your birth.